Here for this interesting topic on urine leakage or urine incontinence. This is a health segment. Remember, this is your popular radio program, Radio Voice of Naija, the Salto Award winners of the year, reaching out to multitudes and thousands of people. At this particular moment, I want Voice of Naija listeners to help me receive a guest speaker. He's no other person but Dr. Johannes Paulus Walterus Rudolphus. Can you say hello to our listeners, Doctor, please?
Hello, good morning.
Right. For those of you who are out there, I want you to know that Dr. Roovers is a gynecologist with Department of Obstetrics and Gynecology, AMC, Amsterdam, or Academic Medical Center, Amsterdam. Currently, he is the medical director of Alan Vrouw, Amsterdam, Pelvic Floor Center. He has previously worked from 1996 as house officer, District Hospital Damongo in Ghana. In 1997, he worked as house officer, Department of Gynecology, University Medical Center, Utrecht. 1997 to 2001, he was research fellow, Department of Gynecology in Utrecht. He had his PhD thesis on the effect of pelvic surgery on pelvic floor function, coordinating two multi-center prospective cooperative studies. 2001 to 2002, he worked as resident in obstetrics and gynecology, Twisteden Hospital in Tilburg. In 2002 to 2004, he became resident in obstetrics and gynecology in UMC Utrecht. Today he is in Radio Voice of Naija Live to discuss on female incontinence or urine leakage. Once again, you can see that he is an expert in this very topic. So feel free to call us on the studio line as we discuss this important health segment issue with Dr. Roovers. We welcome you, sir, once again to our studio.
Thank you.
Now, incontinence or urine leakage describes the inability to control the passage of urine. It is actually a symptom, not a disease, and can range in severity from an occasional small amount of urine passing to constant urine leakage to a complete inability to hold any urine. Some people experience it at specific times during sex or other physical activity, or when sneezing or laughing. Most women mistakenly believe that stress incontinence is a normal part of aging, while that is not true. Stress incontinence does primarily affect women ages 35 to 60, according to the World Health Organization. Now, the expert himself is here to tell us more about this urine leakage. Dr. Roovers, what is incontinence? Can you explain that to our listeners?
Well, I think that was a wonderful introduction. And you told most about it, because it's true. It's a very common condition.
Yeah.
It's in fact not a disease. And it's bothersome. And it affects the life of women, because they lose the freedom to go and stand where they want, and they always are worried about the leakage.
Really?
In fact, it happens in about 40 to 50% of all women who are aged over 40. So it's a very common condition. And there are several types of urinary incontinence. and two of those types are most common.
Now, before we go to that, would you please tell us the cause of incontinence? What causes incontinence? Is it lifestyle or is it biological?
Well, it depends a little bit on the type of the incontinence, but the most prevalent type is stress incontinence, which means that you leak when you cough or sneeze or do exercises. And the most common cause of that type of incontinence is vaginal delivery and aging. So if you have never delivered,
yeah,
then the risk on stress incontinence is very low.
Okay.
But most women experience the first symptoms
yeah.
after they have given birth, and then if they get older,
yeah.
the pelvic floor muscles weaken a little bit.
Wow.
And then it's difficult to compensate the damage that has occurred during the delivery, and then women get the symptoms. So we see two peaks of ages. We see them around the age that they have vaginally delivered.
Yeah.
So let's say between 30 and 40, and we see a second peak when they have the menopause.
Yeah.
So around 55.
Okay. So diseases like diabetes, can they cause leakage in a woman?
Can what cause?
Like diabetes.
Diabetes.
Because you
yes,
mentioned about
pregnancy. Yes, then
okay.
you go to more another type of incontinence. There are also women who have problems to control the bladder. It's not related to exercise or sneezing or coughing, but it is more that they have very frequent voiding, and that they always have to hurry to reach the toilet in time. And then sometimes they just are there too late, and then they start losing urine, and that may be the complete bladder content.
Wow.
And that one is related to diabetes, for example.
Okay.
So if you have diabetes, you have a higher risk of this type of incontinence.
Oh, I also read something about constipation. How does it relate to urine leakage?
To constipation?
Yeah.
Well, that's a difficult question. It may have several things.
Obesity.
But let's talk about constipation. One of the reasons may that if you tend to lose your urine all day, maybe you are going to contract your pelvic floor to hold the urine.
Yeah.
And because then you overtension your pelvic floor, it's difficult to get the stool out, and then you get constipated.
Okay.
That's a possibility.
Okay.
And about the relation with obesity.
Yeah.
If you are more heavy and you cough or you push or you strain or you do whatever exercise, the forces on your pelvic floor are more severe than if you have no overweight.
Okay.
So that means that if you have overweight, you are more likely to damage your pelvic floor by all the exercises that you do, and this damage may ultimately result in urinary incontinence. So sometimes just losing some weight will help you to get rid of the incontinence.
Wow.
But if it is too severe, that doesn't work anymore.
And what you are trying to tell us, Dr. Robert, is that this is a problem common with women who have reached 30 to 60 years. Is that?
It starts from the age of 30, 35, after the first delivery. And then with increasing age, it's more common. And we know that almost half of the women of the age over 50 experience now and then urinary incontinence.
Wow.
But of course this is not something that you share on parties or when you go to the supermarket. It's not something you easily talk about. It's very common and it is easy to solve.
You know, Doctor, that is why I'm very, very delighted that you came, because I see that there are so many things women don't talk about. Probably they feel very shy, and then how do the younger women learn? How do they learn? Because elderly women must tell us about some of these things, so that when you are growing and you begin to notice certain things, then you know that, okay, my mama had it, or my grandma had it, then I'm having it too. You know, but they don't talk about it.
But for that reason, it's so important that you spend your radio program on it, because that helps,
Yes.
And at the moment that women are ashamed about incontinence. They think, especially if they are young, they think it is something of the older lady, which is not true. It's not an elderly disease. It's really also something of young women. So at the moment that they realize that it's nothing to be ashamed about because it's very common, then hopefully they seek medical help.
Well, those out there, ladies, today is your day. Please give us a call right now. Dr. Rovers is here and he is waiting to receive your call and your questions because I may not be able to reflect maybe the way you feel. So give us a call on 7371619. While we are discussing this issue, I know that many of you sent emails to us and you were asking, why have we discussed so much about cancer and discussed so much about fibroid and then we are not talking about urine loss? That's why we brought Dr. Rovers today, for you, especially for you. So don't just listen, pick up your phone right now and give us a call at 7371619, Amsterdam 020. Okay, we expect your call. You know, the majority of women suffer privately from incontinence for years. Maybe they wait from 3 to 10 years before seeking treatment. Can you explain why it is so, based on your experience? Why do they stay too long before they come to you?
Reason 1 is that they don't know that there are solutions. Reason 2 is that they are maybe ashamed. Reason 3 is that a lot of women experience these symptoms after they have vaginally delivered babies, and then are just too busy to take care of the little kids, and they forget about their own health and they are only just concerned about the kids.
Yeah.
So there are several reasons.
Okay.
But we know from investigations that it's only 20% of the women, so 1 out of 5, that seeks medical help.
And the rest just keep quiet?
They stay at home and they go to the supermarket to buy pads.
Yeah.
We spend each year in the Netherlands 180 million euro for incontinence pads.
Oh, such a huge...
180 million. And then, you know, some women, they don't buy pads because they are ashamed to buy pads. So they will just use different sanitary material, and that's another 180 million euro.
Wow.
So from all perspectives, even from a cost perspective, it's better to seek medical help, because then we can get rid of the symptoms.
Yeah, but since this is something common with women, so why would they be shy to come to a gynecologist?
Well, first of all, if they first have to go to the general practitioner.
Yeah.
And sometimes it's also the general practitioner who is not aware of all the solutions that may exist. So sometimes they go to the general practitioner, and the general practitioners will say, well, you know, it's difficult to solve, or you have to get used to it. So some of the part we never reach the gynecologist. And then most of them, they think that there's nothing that can be done, that there are no solutions. So they say, well, why would I go? There are no solutions.
Yeah, but doctor, then don't you see that this will affect the sexual life of that woman and her husband?
Yeah, very much.
So the men will not complain about that, and I believe that some of them, if they are shy to meet a gynecologist, they will also be shy to meet their men, and then they will begin to deprive the men of their sexual desire.
Yeah.
Don't you think so?
Yes.
Don't you agree with me? So when women begin to say that they don't feel like having sexual intercourse with their husband, don't you think something is wrong?
Yeah, I completely agree. And we know that during intercourse, I mean, the women that have leakage, intercourse is a provocating factor that also then will show some leakage. But you know, it's not again, it's not something that you easily discuss with your friends. You don't easily discuss it with your general practitioner. We gynecologists are very used to talk with patients about sexual intercourse and all these things. But before you are on the chair in a room, you know, there is some steps to take.
Yes.
And another thing is that we have more insight now than 20 years ago what can be done.
Yeah, but...
And you know, many years ago we advised our patients to do all kind of exercises by themselves.
Yeah, okay.
So we would give them a leaflet with some written information how you do your exercise.
Yeah.
And he would say, okay, you have to start voiding, to start urinating, and then stop, and then go on and stop, to make the pelvic floor muscle stronger.
Okay.
Now we know that those advices are not good advices.
Yes.
You should not go and stop and go and stop. So we have better insight in which exercises help to get rid of the incontinence. And in fact, the best thing to do is to go to a specialized physiotherapist who can help you with these exercises. And they provide what is called biofeedback therapy. It's a type of pelvic physiotherapy that also makes use of vaginal exercises, and then you get the feedback because you see something, whether you do the exercise is good or wrong. So for example, you have a device in your vagina, and the physiotherapist asks you to contract your pelvic floor muscles, and then there is a green light if you do it okay, and a red light if you do it wrong.
Wow.
And so you can learn how to manage and how to handle with your pelvic floor muscles. And if that is not going to work, but it will work in more than 50% of the patients, and if that is not going to work, we can do a small surgery.
Yeah.
And it helps about 90 to 95% of the patients. And it is a day surgery, so you come in the morning and you leave in the afternoon.
Wow.
And we didn't have those solutions 20 years ago.
Yeah.
So that's another reason we have more and more to offer to our patients.
Yeah, but Dr. Rovers, how are you people making sure that these information are passed out, you know? Because if I did not stretch forth my hand to reach out to get a gynecologist, you know how long it has taken me to keep calling, looking for a specialist that will come and talk about urine loss.
Yeah.
Until I got Professor De La Rosa, and then he said, oh, I have an expert that is inside. So why are you guys not making effort to reach out except a patient comes? I think we are in an era, doctor, where you people will carry what you've learned and then you reach the masses. I mean, you reach them.
Well, we do. We have a pelvic floor center. It's called Urologist.
Yeah.
You mentioned it during your introduction.
Yeah.
We have a website. It's called urologist.nl.
Yeah.
And we try to reach out. So that means that if you go for Google and you hit in pelvic floor center, if you hit in urinary incontinence, Amsterdam, you will come to our website, and we will try to explain how good the options are.
Yeah, but that's not what I'm talking about. I'm talking about for the lay woman, like the grassroots, who does not even know what incontinence is.
Yeah.
I managed to know incontinence because I'm from a medical home. Alright, so sometimes I do hear mothers speaking about a leakage and whatever, so I'm picking the little things. So for those who are very ignorant, how do we pass message to them?
I think that your program really helps to make it more easy to talk about incontinence.
Yes.
It's like miscarriage. At the moment that you start talking about it to your friends, you find out that everyone knows someone who had a miscarriage.
Exactly.
But before you have experienced it yourself, it's difficult to start talking about it. And it's like a taboo.
Yeah,
right?
exactly.
And it's the same with incontinence. At the moment that you have the guts to talk about it, you will find out that it is more common.
Yes.
So I think that we just have to start from somewhere. Someone goes to a pelvic floor center and has a successful treatment, and goes back and talks to her friends and says, well, you know, I was ashamed, but I went there and they were very relaxed and they offered me some help, and now I'm rid of my symptoms.
Wow.
And then the word will spread, you know, and then people will start to talk more about it.
Yeah.
And we have had taboos in the past where we now talk very easily about. So hopefully the same will happen to incontinence.
Yeah.
And I will tell you an even larger taboo.
Yeah.
And that is incontinence for stool.
Yeah, we are going to talk more.
And you know, that's even a larger taboo. So it's a matter of time. Wow.
Well, we are taking a break right now, and please feel free to call us on 020-737-1619. We are having a live discussion on Radio Voice of Naija with Dr. Rovers of Urologist Center.